So I've been doing a lot more standalone MIGs for pseudophakic patients lately, and a combination that I really like is a standalone GAT type goniotomy with an iDose. And this particular patient's kind of interesting. She has a history of pseudoexfoliation syndrome. She's already had cataract surgery. She did not have MIGs at the time of cataract surgery, and her pressure has been steadily increasing, now into the high 30s, even on 4 drops. And so we decided to go to the operating room and try to remove as much of her trabecular meshwork as we could, and also put in an iDose to help with some of the medication burden. So when I'm doing these standalone MIGs, I like to make my incisions a little bit more anterior than I otherwise would during phaco. This helps a lot because it minimizes any bleeding, which can really help to improve the quality of the view of the nasal angle. So here we've made some incisions, and we're putting a little bit of viscoelastic inside the eye and on the top of the eye. And here you can nicely see the pigmented trabecular meshwork. And typically when I do a GAT type goniotomy, I'm either using the New World Medical Via device or the Sight Sciences Omni device. This is the Via. And I usually try to do somewhere between 180 degree and 270 degree GAT style goniotomy. So this is a device where you thread a microcatheter into Schlemm's canal, and as you advance it, you can push viscoelastic and perform a little bit of a canaloplasty. And in this case, we're going to go about 180 degrees and start stripping. And so this will be about a 180 degree goniotomy on one side, and then I'll turn it around and go backhanded to remove about another maybe 90 degrees of trabecular meshwork. I find this device to be pretty easy to use. It has a very, very thin profile. It's a little bit smaller gauge than the Omni, and so in that sense, it's a little easier to maneuver in the angle, and the method of canaloplasty is quite nice because you have a lot of control over when the viscoelastic is delivered and how much viscoelastic is delivered. So we've already done the goniotomy, not too much reflux, and we're going to put a little bit more viscoelastic inside the eye just to make sure that the eye is firm for the iDose. But I've had a lot more success doing this over the last maybe 18 months, taking patients back to the operating room and doing some sort of angle procedure. And it's worked quite well for me and for patients. I think a lot of them find it very approachable, especially when you compare it to some of the more invasive glaucoma surgeries like filtration surgery or even a diode. And while of course there's always going to be a role for those procedures, I think in some instances it's really helpful when you can just do something in the angle to get a patient to where they need to go. So here we are doing the iDose, dimpling down, and then making sure it's in good position. Do a little tap on each side to make sure it's pretty firm. Looks good. So now all we have to do is remove a little bit of viscoelastic, and we'll call it a day. So yeah, this patient did great. She did have a little bit of a hyphema on day one, which is to be expected when you're doing more than 180 degrees of a goniotomy. But her pressure was 8 on day one, and I expect it to remain pretty good. She certainly doesn't need a pressure of single digits going forward. I think anything under 21 on drops would be appropriate for her at her stage of disease and at her stage of life. But yeah, she did very well, and I found that the surgery is becoming rather normal for me. I probably do one case a week like this, so I found it to be pretty effective. But yeah, thanks for listening.